Cystic fibrosis. Cystic fibrosis is a hereditary disorder that affects the cell of the lungs, pancreas, and the small abnormal mucus secretion in these regions cause symptoms including coughing, poor digestion, increased under ability to infection. Most untreated cystic fibrosis individual will not live till 20. The chromosome 7 cells that line the airways in the lung produce abnormal mucus due to a mutation in the cystic fibrosis transmembrane regulatory gene on chromosome 7. Most commonly, the mutation in the cystic fibrosis gene is a 3 base pair deletion. Deletion of this base pair in the gene sequence results in the deletion of one amino acid in the protein that is. In normal cells, the cystic fibrosis protein functions as a channel to move chloride ion across cell membrane. The cystic fibrosis chloride channel works with other channels to set up an ionic gradient, different in the number and the type of ions that are inside versus outside the cell. Normally, cells like to keep more chloride ion outside the cell than inside. This is because the chloride ion attract water out of the cell and into the mucus layer. The mucus layer protects cells by trapping inhaled particles and bacteria. Keeping the mucus layer moist allows the cilia to sweep up out this harmful debris. When the cystic fibrosis channel protein is mutated in cystic fibrosis, it can't transport chloride ions across the membrane. As a result, too few chloride ions move into the mucus layer and too many sodium ions move into the cell. This causes the water to reverse direction and flow back into the cell, drying out the mucus layer. The mucus layer becomes thick and sticky, preventing the cilia from clearing debris. This causes infection in individuals of cystic fibrosis. Since all the cells of cystic fibrosis proteins have the defective protein, large quantities of thick, sticky mucus build up through the lungs and other organs. This results in the severity of symptoms seen in